and thanks for being with us here today. We're glad you could join us to hear more directly from the Hub as they continue to support the vulnerable people of Wetaskiwin. I'm Richard Horncastle with the Leduc, Nisku, and Wetaskiwin Chamber of Commerce. The Chamber is really proud of its role in connecting businesses and community leaders and service providers and residents especially, and we're glad to be just a small part of today's information session. We are, of course, on Treaty 6 lands, which is important to acknowledge. This place has been a traditional meeting ground for many Indigenous people, and I would add, it is in their spirit of cooperation and harmony that we meet here today to talk and share and work together. And I especially want to take a moment to recognize the trauma that many are experiencing today and that they have experienced in the past. With us today is Jessica Hutton, CEO of the Camrose Open Door Society. I'm especially proud of our friendship. Jessica and I've met a few times over the past few weeks, and I want to publicly thank her for never making me feel uncomfortable or stupid, which if you ask my boss can be hard to do, let's be honest. These are difficult conversations to have. And as I mentioned last night, I've thrown some around some ideas, and poor Jessica's probably heard them a million times, but she's never rolled her eyes or made me feel ignorant about it. And I appreciate that. Like many, I'm learning a lot about what it means to be homeless or vulnerable or even traumatized. And I can't help but hope that today others will also learn more about the trying circumstances that our friends and neighbors face. With us today, too, are Carly Dolan, who is a program director, and Tristan Shahayab, he's a youth support worker. They'll also be taking part in the presentation today. Of course, if you have any questions, put them in the chat below. We will try to get to as many questions as we can. We've got about an hour here today. So without any further ado, you don't need to hear from me. You're here to hear from the Hub. So it's my pleasure to introduce to you Jessica Hutton.
Thank you, Richard. I appreciate it. As always, we really appreciate the relationship we have with the Chamber and our capacity to work together. We're glad to be here today to give an update here on what is happening with the Hub and how we're moving forward. So right off the top, we will delve into that. We are going to talk today about our plans with regards to what is going to happen with the Hub. Our last day in the building we are in, the Civic building, is August 10th. And the last day the clients will be able to use the building is August 4th. And so we are going to talk here today about the transition of where we are going. We are moving to a 24/7 outreach model. We do not have another building lined up. That is not something that we have been able to find due to circumstances. And so we would like to just provide some information to the local businesses and to the community around the change that is going to happen. All businesses and the community at large should be anticipating quite a monumental change within the city itself, given the amount of individuals and the complexity of what is going on and how and what that's going to look like. So moving forward, we went into the Civic building on November 12th, 2020. And for those of you who had followed our journey within Wetaskiwin, we went into the Civic building sort of on an emergency needed basis because we had looked at purchasing some private real estate and that deal was interfered with. And so we were not able to move forward with it. And so we went into the Civic building provided by the city as just an emergency response. And that's been very clear from the beginning, is that the building was not where any of us wanted to be. Goodness knows the Open Door did not want to be in the building. That wasn't our best case scenario. But what was the best case scenario was that we had a roof over people's heads. So when we came in to deal with a crisis that was occurring immediately. It was October. It was getting cold. We needed to open the doors and we needed to move forward with something quickly. And so we came in with our programming, basically at a crisis response. And when we build our programming wherever we are across Alberta and how our work is done, our programming is built on best practice, on research, on fact, and then with community dynamics as well in mind. And one of the big things we focused on was reconciliation. We knew that that was going to be a huge part of how we built our programming. So one of the things that the Hub has given us is an accurate picture of the actual spectrum of the homelessness situation that's going on in the city of Wetaskiwin. So to date, over 450 individuals have been supported. And that is everything from individuals who are homeless to precariously housed, at risk of homelessness. There's a lot of different definitions and nuances in this sort of vulnerable population that we are seeing. So we were really able to get quite an interesting handle on what was going on within the city and how it was going on. And so the individuals that we have supported, some use the emergency shelter, some don't. Some require other supports to remain independently housed in the community. Regardless, 450 plus individuals utilize pieces of the hub in order to remain alive and supported. And so we were able to collect things that, again, haven't been collected before. The needs of the population, the demographics of the population, their reasons for being in situations they were in. And this number that we also looked at also needs to reflect the fact that we opened in the middle of a pandemic. And as we've seen across Alberta, there was increased homelessness and there was increased issues with vulnerable individuals as a result of COVID. So both of those things have happened at the same time. And we also want to be clear that the individuals accessing the support are mostly individuals who identify themselves as residents of Wetaskiwin. We are not, contrary to rumors, we are not busing people in from anywhere because that's not something that we would do. This is absolutely something that is happening within the city of Wetaskiwin and individuals who do require the service. Our emergency housing has nightly averaged between 40 to 60 individuals. About a month ago, we started to see a climb again where we were really sitting actually close to 70 a night. And that does happen. It sort of goes, sort of ebbs and flows with the amount of people or who's in an emergency housing nightly. And so those are the individuals obviously we're most concerned about, is the ones who are going to be completely without a roof over their head. We have an entire youth area in which youth are supported. And Tristan will talk a little bit later about what that looks like. And then we have the mental health diversion program, which is specifically targeted to individuals who have been heavily involved in crime and who are looking or we're looking to help them out of a lifestyle of crime. And so this works with the RCMP and with our Crown and with our criminal justice system to divert people out of the criminal justice system. And Carly will speak a little bit to that later. For those of you who may have followed any of my presentations, this always seems to show up. This is the Maslow's hierarchy of needs. This is not something the Open Door created. This is something that has come from the world of psychology and is many, many years old. And it basically assists us in understanding that in order for somebody to have their needs met, there's a hierarchy of how that works. And the very bottom there is that they have to have food and shelter and sleep and clothing over top of their heads before anything else can occur. And so one of the really interesting things that we have seen happen since the hub opened is that as these individuals had the roof over their head, had food in their bellies, and were warm and had those basic necessities of life, that they were then able to make decisions and they were able to actually start engaging in programming. Asking a person living rough out in the freezing cold in a tent somewhere to engage in programming is almost impossible. And so one of the things we were able to do was to stabilize everyone and start working them up this hierarchy. So obviously one of the massive concerns we have in going to a 24/7 outreach model in which we will not have a roof over our heads is that all the individuals that have received help through the hub will go back to the very bottom of this, where they will be struggling to just have their basic needs met. And that's a huge concern for us with the traction that we have made. The programming that we have at the Open Door across our programs, across our 20 plus programs across Central Alberta, all of our programs are built on this model because this is the model that actually elicits change and actually gets a response from individuals. So being in the Civic building, like I mentioned, we were in the Civic building. The city was able to provide that to us, which has been a good thing in the sense of being able to provide a roof over, but also we all know it's the wrong location. And everybody has been absolutely clear about that since the get-go. It's the wrong location. It's not set up correctly. We are well aware there's safety concerns inside and out, and there's not enough room. And so all of us have been very vocal about that. We are very, very concerned, and we're very aware of the concerns, and we're concerned ourselves with regards to the security and the safety issues. There have always been issues with safety in Wetaskiwin. We knew that when we came in. And we knew that graffiti was an issue. We knew that bike chop shops were an issue. We knew that drug use was. We knew that prostitution was. We knew that public intoxication was. We knew those things were occurring. And they have occurred outside the hub, absolutely. And the one thing that is different with them occurring within our eyesight is that we're able to get a handle on them. And what I mean by that is that the individuals who used to do that across town are doing it close enough to us that it means that we can collect information and feed it to the RCMP. And we have been able to get numerous amounts of RCMP information over to them so that they can actually make appropriate arrests and break up some of these things that have been happening across the city of Wetaskiwin because of information that we're able to push forward. So the very thing that actually has frustrated people about the hub is the very thing that's actually going to make quite a bit of a difference, because we've been able to target some of those prolific offenders, and we've been able to target where and who is connected how, and we've been able to push back on that and really get a handle on it. So our relationship with the RCMP has been paramount in us working absolutely side by side. They work right alongside with us in and outside of our building. We work in and outside of their building with them. We're able to absolutely work alongside each other to really target the things that have occurred and be able to start steering the ship so that we no longer have some of these major prolific things happening. So in terms of the not enough room in the building, I want to be clear about the fact that we absolutely have safety issues both in and outside of the building. The building is an old fire station that then had the transit buses in it. It doesn't have appropriate doors. It doesn't have, and that's no fault of the building. It is literally the only place we had to go, but it isn't the way that a typical shelter or a typical program that we would run would be set up. And there's no reason, nothing we could do other than just simply operate to the very best of our ability. And we made the choice as the open door that saving lives and not having people out in the freezing cold dying superseded what we knew we could do on the inside. And we've developed programs and developed practices accordingly on the inside to do the very best to support a very, very, very sick population. So weighing against the wrong location, safety concerns, not enough room, we also knew that the building would provide us life-saving supports. And that has been the biggest thing that we have definitely seen an impact on. The capacity to run medical interventions because we have a building, the capacity to be able to save lives, to have the clients with warm, out of fed, all of these things that save their lives, that has been monumental. So even though the building is not set up, it still has saved lives. We have been able to provide interventions, all the basic needs we've still been able to provide. We can do crisis response. We can do all of our medical response. It provides emergency housing. So even though it's not the right location, it still has worked to provide us what we need. We also knew that that building wasn't a wonderful place to go, but you know what? It still saved lives. And that was what the choice was that the open door made. Following us beginning our work, in fact, before we even began our work, we were working with a number of ministries to have a cross-ministerial approach to be able to respond holistically to a very, very long-standing and concerning issue within the city of Wetaskiwin. And we have, for a year, had working groups, Indigenous relations, both provincial and federal, seniors in housing, all of these ministries, along with Muskagees, along with multiple granting companies and funders, who have worked alongside us to really look at a long-standing, sustainable approach to be able to really steer things in the city of Wetaskiwin. It does not happen overnight. It doesn't happen in a matter of months. We were able to monumentally, and I mean we as in those partners who were involved in the hub, not just the open door, we were able to monumentally shift dynamics in terms of the amount of individuals using the hospital, the amount of individuals being arrested and charged. We were able to impact a lot of those statistics very, very quickly. But if we were able to build on that further, imagine where we could have gone and what we could have done if we really could have kept the steam that we had with that ship going. And so we continue to work with all of these ministries. We continue to work with all of our partners to provide and to try to come up with a longer term approach. So this is the way that the hub works. This is a tried and true model in which there's actually many hubs across Canada, and we are part of, in our youth hub world, we're actually part of sort of the expert front end of the building of that, and what that has looked like. And then now that we're seeing across Canada adult hubs really come to fruition, this is very much something that is not just to the open door, is not just unique to the open door, but definitely a way that a lot of hubs are moving towards. So individuals who come into the hub get a full navigation, a full wraparound service. And that includes all of our partners. So you'll see at the bottom, there are many community partners, and not all of them are on there, but many different community partners who work embedded with us. And so that means they're either in our building with us at certain times, or we're sending clients to them, or there's some sort of way that we are really strongly working together. And so once we have that partner support wrapped around an individual, and they have that roof over their head. So our emergency housing is just one piece of our hub. So the hub itself is an umbrella, picture it as an umbrella. And then all of our programs that happen through the hub are all underneath the hub. So the emergency housing that is at the back end of the Civic building actually is a one program that somebody can access through the hub. So we're able to provide that partner approach, that wraparound service, really understanding through assessments, through really doing very clear intakes with individuals, what and how we're actually able to support individuals. And once that person has been well established and well supported, then we're able to transition them into the long-term services, which is where they end up very stable. So typically we're seeing, we're still in very much the front end of this because we're just less than a year into it, but very much seeing individuals, even some of the individuals we've had through, beginning to transition out the other end, where they have access services and now they are somewhere else other than with us because they're able to do that stably. So this is the model with which we work in terms of our hub, and then we have multiple programs underneath. And that allows us then to really target how an individual is able to receive supports. We still are absolutely lacking in the city of Wetaskiwin certain particular things. FCSS in Wetaskiwin has been very, very good at identifying some of these things, such as transitional housing, poverty, food security, things like that, that definitely play into factors with the vulnerable population. And there is definitely a movement from the FCSS in Wetaskiwin to really tackling this head on, which is a huge fundamental change to Wetaskiwin and absolutely needed. So these are the types of things that a hub can bring forward in the actual gaps of what is going on and how we actually target that. So the hub has had huge impacts on individuals. So as I said, we've had over 450 individuals. Our intake sort of comes in ebbs and flows. In the last 6 weeks, we have had quite an alarming uptake of individuals needing to intake into our facility. And we're trying to get a clear understanding. It usually takes us a number of weeks after an individual comes in to really get a handle on the what and the how and the why as to when they came in, just due to how we collect information and the assessments that are done. And so we're just sort of watching that trend as to why we've had a number of individuals and what is going on. And what's really interesting is that the information that we're able to pull from our stats, so the numbers that you're seeing on your screen here, these come from what is called validated assessments. So this means that we don't just decide, somebody doesn't just sit down from the open door and go, well, I'm going to decide that you're a complex medical patient, or I'm going to decide that you've experienced trauma. We actually do assessments. And what a validated assessment tool is it means it's common in our field. It means that it's been tested independently. And it means that validated assessment tool is something that is a language that multiple stakeholders would speak. And so when we do our assessments, that's where our data comes from. We don't throw around numbers. We do clearly articulate when we anecdotally collect information, but our base numbers that are coming out of the hub, the stats that we have repeatedly presented, do come from validated assessment tools and from actual statistical collection. So 100% of our individuals have experienced trauma. One of the things that's very interesting to note is that trauma has been determined as being a gateway to addiction. And I think I need to say that again. Trauma is a gateway to addiction. 100% of the individuals who have utilized our hub are traumatized. It doesn't take much to figure out why we're seeing addiction levels the way we are. And so in order to work back against that, it's not just telling somebody to stop using, because it doesn't work that way. This is about embedded programming that needs to save lives because somebody's trauma is so significant that they are to the point where they are using a substance to try to cope. So 96% are complex medical patients. That is an AHS statistic in which they are the patients that they see with us. That's the number they have. 92% experience addiction with us. Obviously not something that is a surprise based on the amount of trauma that we're seeing. 100% of individuals are experiencing mental health issue or crisis. And there is a significant, about 25% of that population, maybe the 20 to 25, and I don't have the full number, but I can tell you from our data poll that it would be between 20 and 25% of this, that in 100% are individuals who are not diagnosed yet. And that's a very scary thing. So somebody who has undiagnosed psychosis, for example, or undiagnosed schizophrenia, or undiagnosed something that would be quite significant, and so would cause behaviors that might look like something else. And so a lot of those individuals will have been involved with the criminal justice system, and that's not the right place for them. They do need appropriate medication and stabilization in programming in order to be able to move forward. So this isn't about, this isn't about just arresting people or policing our way out of this, because individuals with a mental health issue that's untreated aren't going to be policed out of this. Roughly 95% are experiencing a concurrent disorder. That means there's more than one thing going on. And when there's more than one thing going on, it becomes very complicated. So somebody has a mental health addiction and a mental health addiction and an addiction issue and a medical issue and. So it means there's multiple things going on we have to factor in. And then roughly 92% have experienced a direct personal loss within the last 2 years, meaning that there is a lot of grief. And we all know that grief sometimes goes hand in hand with trauma, and grief can also be very difficult and can really numb one to how they're moving forward. So the impacts that the hub has to date impacted is reduced shoplifting, reduced theft, reduced break and enters, reduced emergency department use, reduced overdoses, reduced use of Narcan. We have been able to do a full response to COVID in the vulnerable population. So prior to us starting, we knew that there was COVID running rampant in the vulnerable population. And of course, when we opened our doors, the COVID did, of course, come in, and we were able to very quickly work with Alberta Health Services and all of our partners to be able to respond to the COVID in the vulnerable population and build an assisted isolation site so that we were able to curb that and stop it from going any further. Our concern when COVID did show up in the vulnerable population was that these individuals were actively in and out of businesses and in and out of sort of all over the place, downtown and all over Wetaskiwin. And we were extremely concerned about them passing the COVID without realizing it. And so having an assisted isolation site was something we went for right away. And because we wanted to curb that very quickly. And so we were able to curb outbreaks, and then we were able to work with Alberta Health Services and Community Health and PCN to be able to get these individuals vaccinated very, very quickly. And so we have had 2 rounds of vaccines go through and a pretty large scale uptake, which has been very, very helpful. And so we were able to get that out to the vulnerable population, knowing that those individuals frequent places where we don't want to have COVID passed. And so that was a huge deal to us to be able to really get some sort of handle on that. And then the other thing that we've been able to do is really get ahead of the treatment and prevention of communicable diseases. So we've had everything from lice, Hep C, STIs, all of that, which of course can be passed. And that is something where we're doing a lot of intervention and a lot of response. We've had testing clinics come in, we've been able to do treatments, we've been able to catch all of this very quickly and really, really start to intervene on some of these things that are quite out of control within not just the vulnerable population, but within Alberta. And so that's something that's been extremely helpful as well for us. The other thing that I think it's really important to point out is the impact of the hub in terms of the economics within the city of Wetaskiwin. We created more than 25 jobs in the middle of a pandemic, and we do purchase locally when we can. And that includes all of our food, that includes our supplies, our vehicles, our laundry services, thousands and thousands and thousands of dollars a month that are going into our supplies, fuel, all of those things. And then all of the jobs that were created, and then the spin-off jobs as well, where other agencies have created jobs within theirs to support things that are going on at the hub. So the economic development in terms of what could be brought into the city of Wetaskiwin is monumental, and that as well has been huge to us. Specifically, the assisted isolation site was huge in sort of providing some of that, you know, a hotel, a catering company, all of those things that were needed in the middle of a pandemic. So we were really able to drive some of that funding right back into the city of Wetaskiwin, which is very important for the Open Door. We do purchase locally in all of our communities where our staff are located. So I'm going to turn it over to Carly here. Carly is the program director for the west of Alberta. We have 2 program directors for east and west, and she's going to speak to the programs that are available through the Open Door and what exactly they are.
Okay, thank you. So as Jessica said, I am the program director for West Central Alberta, which oversees the Wetaskiwin programs that we're running. And I know we spoke to trauma a lot earlier in this presentation. All of our programs through this agency on the whole are trauma-informed, client-centered, wraparound, and holistic. So that is what we base all of our programs that are then offered to all of our clientele, have all of that at the base of them. So as you can see, we have quite a few programs that are available through our hub. Hub navigation and case management being a huge one. All clients that come into the hub, so all 450 individuals who have access supports have been able to access the hub navigation and case management. And this looks very different depending on the individual. So some need very little level of support and some need very intense. Jessica showed the model earlier where when they come in, we have a navigation process where people come in, we have an intake, we collect data, we ask questions, we're able to triage a client's needs and then refer them to either internal programs that they can access to fulfill those gaps or outside partners, as we are very big on not duplicating services. And we do utilize a number of service providers that are existing in the community to be able to attach people to whatever supports are appropriate for them. Case management also includes such things as filling out applications for funding, for obtaining IDs, making and keeping appointments. So it's a very diverse program that really depends on each individual client's needs. We also have quite a robust addiction support program. So we have addictions clinics with addictions physicians that specialize in medicine that support individuals that are experiencing addiction. We also offer group and one-on-one counseling for individuals that are experiencing addiction. So we do have a very wide base of supports, everything from medications to support them, counseling, group supports. And these clinics are also targeting the symptoms that are then leading to addiction. So it could be depression, anxiety, schizophrenia, lack of sleep. So there's lots of factors that come into play in these clinics, and these addictions physicians are very well skilled at assessing a client and providing the necessary support. Emergency housing is one program available through our hub. So I know a lot of community perception is that we're just a shelter, and that is not the case. Emergency housing is only one piece of what we do. So we do have emergency housing in our hub. That is obviously the most easily seen piece of what we do, but it is not something that is our biggest program to date. Like I said, hub navigation and case management is by far the biggest program. That's what everyone receives, whether or not they need housing. Medical supports has been a huge piece of what we do. We have medical staff on our team, as well as from outside service providers that are brought in to provide medical supports to our clients in our location. Some of those individuals would be a nurse practitioner, registered nurse, LPN, family physicians, and our addictions physicians as well. We also have community paramedics that do come in and provide support in the hub. Our mental health diversion program is something that we had developed when we identified the need that there are a large number of our clients who are involved in the criminal justice system, and as Jessica spoke to, are likely not best suited to be there. So this program works very closely with RCMP, with duty counsel, prosecution, and probations. It works to identify individuals who are currently in the justice system that would benefit from being diverted to mental health and addiction supports as opposed to being remanded. This is overseen by one of our staff. They work to identify them, they work to divert them to our additional programs and follow it along. If the program is not successful, then there is the option to lay the charge and pursue things through the normal justice system. But we feel like it's a very important opportunity to have them to have access to mental health and addictions supports, as opposed to being shuffled through the justice system right off the bat. This program also provides court support. So even individuals who are not necessarily being diverted, they are supported to make sure that they are attending their court dates and fulfilling their obligations through this work. Food has been a huge piece of the puzzle for us as well. So we've had a lot of clients accessing food. We are currently preparing and serving 2 meals a day. So we provide breakfast and supper. We provide lunch on Sundays as well, and Neighbors Outreach has been able to provide lunch 6 days a week. So food is a huge piece of what we do, and it is an essential piece. Moving forward, we don't know what that looks like when we don't have access to prepare and serve food to our clients. Last one I will speak to is youth supports, and I'm not going to speak hugely to that because Tristan is here and he's going to speak in more detail, but that is an additional program that we do have available through the hub for clients ages 11 to 24.
Hi guys, my name is Tristan Shahive. I'm the youth support navigator, as Carlene introduced me there. Now, in regards to the hub, the youth program is probably the one that's going to be affected the least by it not being open here, but it definitely still has a lot of effects, thanks to partnerships with other organizations and groups, and also internal programming that we offer within communities within nearby. Obviously, we identify with some of those safety issues as well, and we want to keep the most vulnerable, being the youth, away from those situations. So we've been able to reroute them into other places as well. Through that programming, we offer everything from emergency housing, crisis interventions, basic necessities such as food, mental health services, and then also some of the not so high priority things in that lower section of the hierarchy scale, being such as going through budgeting, interviewing strategies, resume developments, goal setting, and peer-to-peer supports. The building has definitely helped us in being able to provide a safe space for some of those kids who need access to get away from crisis interventions by accessing the front end of the building. And then obviously we've also had a lot of development within reaching out to the other organizations and helping with that. So far, we through the numbers that Jessica showed, we have almost 50, we have about 46 people who have accessed the youth program within the Wetaskiwin area. Over 20 of those are still accessing those on a day-to-day scale. And that's everything from, we've had about 6 clients who have been relocated for safer living arrangements due to crises at home. We've had several of them recently be able to gain some employment with help through interviewing skills and resume development. And several have accessed the addiction programs and reaching out to all of those services that we offer. Beyond that, if anybody has any questions about that, please direct them to me and I'll be happy to answer them whenever we get to this question section of this.
Absolutely. Thank you, Tristan. So in terms of our next steps, what we believe is going to happen, and I just want to be very clear that we are doing something. We are transitioning people back into an at-risk lifestyle and basically into homelessness in many cases. And this is not something that there is any manual on. None of us, none of the all the trained staff who work for the Open Door, nobody has done a transition back to homelessness, and none of our community partners have. And we've looked for literature across Canada. This isn't something that really has been done before. And so all of us, not just the Open Door, everybody who's involved in this is really trying to understand how this is going to look. So our next steps in terms of what to expect. As an overall whole within the city of Wetaskiwin, we can expect to see increased medical emergencies. We can expect to see increased drug use as individuals who were stabilized now have that trauma of losing a place to live again. We can expect to see increased loitering. Theft and break-in enters. We can expect to see increased use of outbuildings and lobbies for shelter because the individuals who have previously been sheltered will no longer have that as an option. And I think what's most scary to us that the Open Door is the potential deaths. We have a great number of individuals who rely on the hub for their medication, for their medical response, for a lot of those things. And we have grave concerns over what is going to happen with those individuals and the potential for death. Our medical department has been very clear about the lives that have been saved because of the hub up till now, and we are very concerned about what that looks like moving forward. So transitioning people back to homelessness. As I mentioned, we're moving to a 24/7 outreach model. What that will look like is we do have vehicles. The Open Door does have vehicles. And what will happen is that we are moving all of our basically outreach onto vehicles. So we will have our accessible, we'll have our tablets, we'll have some food, some water, some medical supplies. Our nurses will travel with us. And we are moving to a 24/7 outreach model. So we will continue to be available, but our capacity to help, and I need to be very clear about this, our capacity to help will be vastly reduced because we will not have a place to take individuals. There will only be so much we can do. So the 24/7 outreach, I've included the helpline here on the bottom. That remains the helpline number that you can call to get help if you do see somebody in the community or somebody is in your business. I want to be very clear that there may not be a lot we can do. We will continue to work alongside the RCMP. We will continue to respond. We will continue to do what we can. But when we do not have a building and we do not have somewhere to take someone, and we are back to that crisis response, there may not be a lot we can do, but we will be in the community. We will be providing outreach. We will be searching out individuals, and we will be desperately attempting to get who we can into other programming outside the community or somewhat stabilized on something in the community. We are recommending to businesses and to all community members that they take naloxone training, and we will provide the naloxone training. And if you watch our social media, please do. We will be providing some public training around the use of the naloxone so that we can have community members prepared for what that might look like. We also recommend that people have sharps containers within their businesses so we don't have the needles around. This has been something that has been really curbed because we were able to really get ahead of the addictions, and we are hoping against hope it doesn't come back, but we're also not naive in knowing that individuals may return to lifestyles and ways of doing things that they did before, and this may find that we do have sharps containers. We also would recommend that everybody updates their first aid training or has ongoing first aid training, because we do expect that there will be an increase in medical emergencies, just given individuals who maybe no longer can access their medications or that are now living rough and don't have something over their head. We are asking that if you can get first aid, it would be very beneficial. The city has put together two working groups, a coalition through FCSS, as well as a safety and well-being committee. And we encourage everybody to be part of the solution. We are begging people to stop with the misinformation and please focus on a solution. We have 450 plus people that are vulnerable that in 2 weeks are going to be back in community, and we need to stop the spreading of the misinformation. We need to stop and just focus on how we provide a solution in the community. The Open Door is staying in the community to provide the 24/7 outreach. We are committed to trying to work this through with our clients. The loss of the building that minimizes our capacity to provide what we can provide, but it does not change our dedication or compassion towards this group of people who is so sick, and we will continue to do that. I ask that you do be patient with our organization and all of our partner organizations as we try to transition. Nobody knows, the police, the hospital, us, all of our partner agencies, nobody knows exactly what it's going to look like. Just please be patient as we try to transition. We remain dedicated to saving lives, and we will need some time to figure out how we can get or what we can get out there as fast as we can. We remain dedicated and are still working on a long-term solution. The working groups still continue. We still are working on the solution. We still are working on what that might look like. However, we are also aware that in 2 weeks, we are going to have a very, very big problem. The Alberta Health Services Medical Officers of Health did present to the city regarding their belief that there will be a public health crisis if we do have people back in the community. We echo this, and this is our reason amongst many for presenting today, is that we really want the community and businesses to understand that we may very well have quite a monumental crisis on our hands, and we really want people to understand what that's going to look and feel like so that we can all mobilize together and meet this with compassion and not frustration when it all lands in 4 weeks from now. back in our bank vestibules and back in tent cities. That is literally our worst case scenario, but we also are very realistic in knowing that this is likely what's going to happen. So if anybody has any questions, we're more than happy to answer them right now. And if you want to be part of the solution with us, absolutely reach out to us or reach out to the working groups the city has put together, because the city's working groups are very much focused on a long-term strategy, which is absolutely necessary. And we have absolutely said that that's the case moving forward. And we would like them to continue to move forward for a long-term strategy. Right now, the Open Door is a little bit more focused on the crisis we have at hand. So I'm more than happy to answer any questions anyone may have for us.
That's great. And sorry for disappearing there. There was a flash of light and a crash of thunder, and then the house went dark, and I wasn't sure if that was an act of God or if I was having a stroke or what was going on. But we're back now. We're ready to go. We appreciate all the questions in the chat. Let's talk like we did last night about the near term, and then maybe we'll start to focus a little bit on the long term. So does the hub have any idea of how many clients they may lose track of in the weeks following the closure of the physical facility?
No, and that's a really good question. Our hope is, because we have almost a year's worth of interaction with many of these individuals, is that they will seek us out, and our intention is to be in enough places that hopefully we can find them. We're not blind to the reality that we may lose track of individuals. I do not have a number of what that's going to be, because like I said, nobody's done this and we don't know what that might look like.
And we've heard a number of times, Jessica, over the information sessions that we've done, that the numbers of people using the shelter seem awfully high. And there is this concern in the community that because the shelter is there and it's widely known, that people are immigrating into the community from outside to use those services. Do you have any idea over the coming weeks as if whether that's going to be mitigated? How many of the people were from Wetaskiwin originally? Do you have any idea, or can you explain, I guess, to the community how many people that you have in your shelter are from that Wetaskiwin area?
Absolutely, for sure. Yeah, that's absolutely a common misconception. And if anyone's following our social media right now, you will note that we have a whole thing that's going on, the myths versus realities of the things we hear and then what's actually happening. So I think to answer that question, there's sort of two pieces to answer. The hub itself and the emergency housing is funded in a way, most of its funding actually comes from funding outside of Wetaskiwin, meaning that it is more of a regional response. So even if somebody is accessing something in the hub that might not be from Wetaskiwin, and I'll get to those numbers in a minute, that is still not Wetaskiwin money that's being necessarily spent. The vast majority of our money has come from Muscatine and has come from the province. So that's actually where it goes. Just as your hospital would service an entire region, just as your Canadian Tire sales to people all the way around the region, that would be the same sort of setup that the hub could provide, and that is often provided to shelters. These areas, the rural areas, often, and I'm not speaking to the Open Door, I'm meaning in general, rural areas often send people who are homeless into Edmonton, into Red Deer. So these are the same conversations that Edmonton and Red Deer have around, wait, why are we getting all these individuals from the rural? Because there are services. That being said, I believe the last number I pulled was 76% of the individuals that, and Carly, nod at me if I'm correct, I think it was 76% of the individuals were actually, were actually identified as Wetaskiwin residents, meaning that had been their place that they had been prior to coming to us. And so I think we have to be very careful here about who we're assigning where. If they're in the community, we do need to help. And like I said, if we can get that full wraparound service around them, then we shouldn't need to have 2 years from now, we shouldn't need to have a shelter at the scope that we have. If we do, we've got a big problem because nobody's done their job right. So we actually need to work ourselves out of a job in a shelter, and we shouldn't need that in 2 years. We should just need a hub that helps individuals. So most individuals are there. We, the Open Door, has never brought people in. However, there has been a couple instances where somebody has come in from out of town. The way we work it across our programs is that we get that person back to the location that they come from and attempt to get them supports in the community that they come from.
And I think I asked you this before, but can you talk a little bit about this integrated approach and how important it is in solving the root causes of homelessness?
Mm-hmm. Absolutely. Yeah. So it's like saying, if you look at the Maslow's hierarchy of needs there that I showed to you, Shelter is one piece at the very bottom of that. So yes, we need shelter, but we also need many, many other things. We need all sorts of different programs. We need food, we need medical, we need all of those things. So unless you have all of that put together, you're really just doing a Band-Aid approach. And that was not what we were interested in when the Open Door came to Wetaskiwin, is we didn't want to Band-Aid it. We definitely jumped headfirst into a crisis response, knew full well we were, because we didn't feel like there was a choice with this population but to respond in a crisis response. The integration of multiple service providers and multiple programs is actually what saves lives and makes long-term change sustainable.
And then looking a little bit further out for your service delivery now, I understand you have 2 vehicles which you purchased locally, and you're going to be trying to keep in touch with your clients as much as you can in terms of delivery of food and medicine and things like that. How does that look now?
Our biggest concern is the delivery of medicine will be interrupted. And the most unfortunate and sickening list that we have had to make, and I say this knowing that this very much is impactful, is the list of the top 12 individuals that will die without their medications. And that is a list we have, and that is a list my team has had to put together. Asking my team to go in and make for over 400 different individualized plans with individuals to transition them away from services has been gut-wrenchingly, sickly, heartbreaking. And that is, it's not at all lost on me what I've asked a team to do, in that we have had to move this way. However, we remain committed to trying to get to these individuals, knowing that we can't get meds to them. They can't get their own meds. There's certain reasons why they're, and I'm not going to delve into that. That is a thing. Food is going to become a major issue. They're not going to be there. They don't have transport across town to get it, food. All of those things that kept people going and engaged in services, they will lose.
Thinking a little bit long-term about your situation in Wetaskiwin, then what is your hope long-term for service provision in Wetaskiwin? What is the hub looking forward to as a vision?
It would be ideal to have a building to operate out of. And one of the things I've been very consistent with is I do not actually believe we should be building a huge monumental shelter, because as I just said, we shouldn't need it. You always, when you start a program, have quite a dramatic uptake before it stabilizes out. And the reason for that is because you have a backlog of people who haven't had programming. And so that's what we're seeing in terms of numbers is very, very high, but it isn't necessarily shocking in terms of the uptake of a program. So we would like to have a hub building and then a smaller place either within that or outside of that for that emergency housing. That being said, and this is something that FCSS has very clearly defined, and very clearly articulated, is that we don't have transition housing within the city of Wetaskiwin. And that is a huge thing that we also had noted, was that we are holding, potentially having people stay with us longer than they should because there isn't a place to go after. And so we're very glad that there has been articulation of further needs in the community, because I mean, FCSS is absolutely right. There needs to be transition housing. There needs to be more of these things. So we would like a large hub location plus the capacity to do a smaller emergency shelter, just while we get everybody stabilized, and then work ourselves down to a very limited emergency shelter.
You've faced some criticism over the last few weeks about the situation around the hub, and I think this is showing my ignorance again, but you've been very patient with my ignorance all along, so I feel safe to do this. I'm wondering if that's because of the sheer number of clients the hub is trying to service out of the Civic Center, or is it because engaging that clientele and getting them the services they need to stop some of these behaviors just hasn't happened yet because you've only been in that facility for a short time? So my question is it that you're overcrowded, or is it that these programs take time? And if the hub was to find a suitable location in Wetaskiwin, would you expect some of that level of graffiti and other things to go down?
Absolutely. So you're right on both accounts. The hub itself does, because we have so many people, it does draw in, absolutely. I also want to be clear that everybody around the hub doesn't necessarily access services in the hub. And we provide services in the hub and then work with the RCMP and CPOs for around the hub. So I think there needs to be very clear determination. If you drive by the building and you see drug use or you see prostitution, call the police. because those are the people who can deal with it. We can't deal with it. We don't have the capacity. We don't have the authority. We go out and we say, get out, move along, stop it. We report it. We call it. Goodness knows we're the biggest reporters because we know it needs to stop. But we do have issues because it's really centralized. It's very easy to see. And the other piece of that is, yes, absolutely. People are still engaged in some of their behaviors while they are engaged in something else. There's a saying in our world, you cannot take away a behavior without replacing it with something. We are in the replacing it with something phase, but we can't get those behaviors gone until we replaced it. So now when we take away the building, we're going to go right back to all the behaviors rather than in the kind of capacity we were right now, where we were starting to see changes in behaviors, and we are seeing reduction in all of that. So it is both of those, Richard.
Is there an ideal location for the hub?
I don't know. I feel like it doesn't matter where we say or ask or look, somebody has an issue with it. And I guess I put that back to the community of Wetaskiwin. Where do you want us to go? Where do you want us to help these poor individuals? Where do you want us to save lives? Because we do need to be close to these individuals' support. So one of the things that Wetaskiwin has is, Alberta Health Services is there, the hospital is there, all of the, the centralized things, the food bank, all of these extra supports. Everything from the Boys and Girls Club for Youth to Children and Family Services, all of these things are centralized in Wetaskiwin. We can't go far away from that because it won't make any sense. So then where do we go? And your guess is as good as mine, because I have driven every street. I have exhausted everything. I have asked and asked. I know I'm not alone. I know that a lot of people have worked with us on that. I don't have an answer.
Yeah, and it goes back to, I want to share with everybody one of the more ignorant things I did. I met with Jessica, a few weeks ago, and I said, I really want to understand what it's like to be homeless. And so maybe if there's a possibility, could I spend a night in the shelter to see what it's like? And Jessica patiently smiled at me and said, you can't experience homelessness if you know that when 24 hours or 48 hours is up, that you're going to go back to your house and your life and your bed and the shelter over your head. And so I think it's really difficult for people to get a feeling of where clients from the hub are coming from and how difficult it is to understand what it's like to walk in those shoes and how difficult it can be to make decisions. I know we hear quite often when we walk downtown from people, well, I wish some of these clients would just choose not to be homeless, and how difficult it can be if you've never had this privilege that I have to come from that safe place and make better decisions. Do you have any comments on that?
Absolutely. You and I are at the top of the pyramid, aren't we? That's where we get to live our life choices, is at the top of the pyramid. That's where we are, is that we have all of those things. So we have that fundamental framework. But when it's hard to even imagine, if you don't know where you're getting your next meal from, and you don't know whether you will be warm tonight or not, and you don't know whether you're going to be safe or not tonight, your capacity to feel like you should be respectful to someone, engage in someone, that doesn't exist. So one of the things we hear is, well, so-and-so was so disrespectful to me. Yeah, probably they were. 100% they were. Because you know what? They're cold, they're hungry, they're starving, they're sick. And you know what? The last thing on their mind is respect. And I think it becomes a community responsibility for us to provide that bottom level. And then we watch people get engaged. We've proven that at the hub. We've proven that as soon as they have that bottom level, there's engagement. So I think absolutely, you're absolutely right. I think that I can go and spend a night at the shelter and feel what it's like, but I would never really understand what it's like to wake up desperate and know that in 2 weeks from now, I have no roof over my head and I don't know where my food's coming from and I'm in full out panic mode. And when somebody's in panic mode and their brain is running on trauma, your critical thinking that happens at the front of your brain retreats to the back of your brain. And you start making decisions that really don't have a lot of common sense attached to them because you're doing it from a safety standpoint. You're doing it only from a fight or flight standpoint. And that is where this population will be in 3-4 weeks.
We promised to have everybody out of here at 1 o'clock, so we'll start to wrap up now. Carly, Tristan, do you have any last remarks?
I don't think so. I think Jessica spoke really well to what we're faced with. And right now, we are tasked with taking our programming and shifting it into an entirely new mode. That, like Jessica said, there is no script for this. There is no way to do this that's been done and documented. So it's definitely daunting. It is emotional for this team, and we are definitely very, very busy just trying to ensure that we're going to be able to provide any sort of services for our clients. So we do appreciate you guys taking the time to listen and to hear, what we've experienced and what we're hoping to do moving forward. And if there is any dialogue, I'm open to discussions. I'm open to listening. I have no issue doing that. So please reach out, and we want to work together to find a solution.
And before I turn the floor over to Jessica for her last remarks, I just want to remind everybody our next chamber event is August 19th with Jonathan Sims of Fielding and Company. He's going to talk about employment and HR law in a post-COVID world. You'll find information in the chat on how to register for that. And as we get that posted, I will turn it back to Jessica for her last remarks.
We just want to say thank you very much for everyone who attended. Thank you for the chamber for having this. It's very important that we all look at this from a community lens. We hope that everybody got the information that they need today, and we really hope that moving forward, we can really find a solution to support all these very, very sick individuals. So thank you everyone for participating.
And I would just say as well, thank you everybody for being here. Like I mentioned yesterday, and I think in just about every session that we've hosted, these are difficult discussions to have. They're really, really difficult. And I admire that 90 people took time out of their day over the lunch hour to come and be a part of this discussion. For good, for bad, for ugly, I think the more the comments we share, the more we learn about each other, the better off we are. I've said it before, I think the more information we have, the better we can do in making decisions. And so we're really proud to be on this journey with you. If you have any questions, you can reach Jessica at the open door. She had the number there, 780-360-2995. If you see somebody in need of aid in the next little while, call that number, and the hub is there to help that. And if you're looking for Narcan kits or Sharps containers, kudos to the hub for recognizing a need and to try to provide the business community with that. We're all just here to look after each other. And so we really appreciate the hub taking time. We appreciate that all of you are here today to be a part of these important discussions. You'll probably see more of this from the chamber as we move forward. So thank you for being here with us today. If you have any questions for Jessica, I know she's easy to reach out to. I do it all the time. So by all means, just send them an email. And yeah, thank you everybody for being a part of this discussion today.